coming in, Mr. Young, and I think it's really important, it speaks highly of you, that you're seeking some assistance with your anxiety that you've been suffering from. So I'm just gonna take a few moments, ask you a couple of questions. If at any point you don't wanna answer anything or you don't feel comfortable, just let me know and we can move past that. Is that okay?
Great, yeah, thank you. Thanks so
Okay.
much.
All right, no worries. So your name is
It's
Trey?
Trey Young.
Alrighty, and you spell it T-R-E-Y?
T-R-A-E.
A-E.
Yeah,
Okay, your last name?
Young.
Y-O-U-N-G.
N-G, that's it.
And what do you prefer to be called?
Trey.
Trey. Alrighty. And your date of birth, Trey?
Date of birth is June 30th, 1998.
And how old are you?
I am 25, and that feels crazy to say. Do not feel 25. And I'm male. Sorry, you didn't ask me
That's
that,
okay.
but I'm male. I saw
That's
it.
okay.
I'll stop cheating.
That's quite all right. And your marital status?
I am newly married.
Oh, well, congratulations.
Thank you.
And were you referred here?
I was not referred here. I just found you guys. Just looking for therapy on
How did you
Google.
find us?
I searched on Google, and it was just one of the first ones that popped up.
Okay.
Yeah.
All right, now this next set of questions I'm gonna ask you are pertaining to your mental health history. So once again, anything that you don't feel comfortable sharing with me, that's quite all right, okay?
Okay, thank you.
Have you previously received any type of mental health services? For instance, psychotherapy, psychiatric services, or counseling?
I have.
Okay.
I saw a therapist for about 2.5 years, 2 years, between 2020 and 2022.
And do you recall the therapist's name?
His name was Davis. I'll leave out his last name.
All right. Are you currently taking any prescription medications?
No, I'm not.
Have you ever been prescribed psychiatric medication?
I have. I
Okay.
took Lexapro.
Okay.
Pretty much, I'd say 2 months after I started therapy. It was anti-anxiety.
Okay.
I'm trying to remember how much I took. I think I started with a pretty low dose, I think 10 milligrams, and then moved
Okay.
up to 20. I think I took it for about 3 or 4 months and then stopped.
Okay. And was this medication prescribed by your therapist or your physician?
It was prescribed by my physician. It was my therapist recommended I talk to my physician about what I was feeling to see if he thought I should get onto some medication. So my therapist encouraged me to.
Alrighty. Now the next set of questions are going to be pertain to your general mental health information. How would you rate your current physical health? Would you say it's poor, unsatisfactory, satisfactory, good, or very good?
I would say good. I'd say good.
Okay.
Yeah, I'm dealing with some like lower body injuries, but
Okay.
I'm able to stay pretty active still, and I feel good overall.
Okay, and that was leading me to my next question, which is, are you having any specific health problems? You mentioned lower body issues.
Yeah, I
Your
have
legs?
some little calf injuries, shin area, and I'm in physical therapy for it. So
Okay.
getting it treated. But other than that, no, I'm okay.
Okay. How would you rate your current sleep habits? Would you say it's poor, unsatisfactory, satisfactory, good, or very good?
I would say my habits are good. I'm really trying to be better about
Okay.
it. It's something I've struggled with in the past, but I think I would say good.
It's
They're
good.
Yeah.
So you aren't experiencing any specific problems with sleeping? The amount of sleep and the quality of your sleep is good?
I would say I was for a long time, but I'm like really trying to guarantee that I get at least 8 hours a night, and it's making a difference.
Good.
So like setting timers at night, like I gotta get in bed now, and I gotta start my routine, and I've got like specific things I take and do that's been making me more rested.
Those are excellent habits to build.
Now I still, again, habits are good. I still feel like the rest isn't as much as I need. Even
okay.
8 hours, I'll wake up and feel really, really
Like
tired.
you need
I'm
more.
Like, what? I went to bed at a good time. What more do I need? But I think anxiety affects, how my quality of sleep. But I would say my habits are, I'm trying.
Gotcha. So you're sleeping, but you're not feeling rested.
Not every night. There are some
Okay.
mornings I would say I'm like, okay, that was a good night of sleep. And some mornings I wake up, I could have gotten 9 hours, and I'll be like, I feel like I barely slept. So
Gotcha.
usually depends on circumstance
Gotcha.
and what's kind of going on in my heart.
Okay. How many times per week do you generally exercise?
I would say 6, probably. I try to take one rest day, but most days I'm exercising.
That's great. Good for you.
Thank you.
What types of exercise do you participate in?
I do weightlifting,
Okay.
running, swimming, biking, basketball. I try to do a lot of different things, but I would say mostly weightlifting and running.
That's
My
impressive.
habits.
Very good.
Thank you. It's very important to me.
Good. And that should help with some of the anxiety that you're experiencing.
That's why it's so important to me.
Yeah.
It was like a lifesaver for the times
Yeah.
I was the most anxious. To
Absolutely.
keep moving. When I'm sitting still at home and don't get outside and don't move and do
Right.
something, I can tell a difference.
Keeps the blood flowing so you get good circulation.
Mm-hmm.
Keep good oxygen coming into the brain, into your organs,
Oh,
which
yeah.
makes you feel good.
It's good medicine.
Okay, fantastic. Please report any difficulties you experience with your appetite or eating problems.
I would say none. I feel good
Okay.
about my eating habits and appetite. Feel good.
All right. Are you currently experiencing overwhelming sadness, grief, or depression?
I think it depends on when you ask me, and I don't know if I would quite put it in the overwhelming category, but I would say I've been dealing with a good bit of sadness recently.
Okay, let's
Yeah.
talk about that for just a minute.
Hmm.
What makes you sad, or have you noticed those times when you're feeling sad?
Well, it's been pretty circumstantial. Like I would
Mm.
say I don't usually just feel sad for nothing. There's usually, not that there's anything wrong with that, but there's usually something in there. Sometimes it takes me a little bit to find it, but I'd say I'm mostly sad about my parents' divorce, which happened a year ago, but their split was 3.5 years ago, and there's still like new things being learned, new kind of
Yeah.
bombs being dropped into it, and it's hard. It's been hard recently.
I
Just
understand.
their situation.
Yeah, that can be tough.
Yeah.
That can be tough on anyone.
Mhm.
So, yeah. Are you currently experiencing anxiety, panic attacks, or have any phobias?
I don't think I have any phobias. I've not had a panic attack in a long time. I have though. I would say I experience anxiety pretty regularly.
Okay.
It's kind of why I'm here. Yeah, it's something I try to manage and deal with the best I can, but it's there to different levels most of the
Yeah.
time.
Yeah.
Yeah.
When would you say you began experiencing anxiety or problems with anxiety?
I think I've struggled with it most of my life. I don't know if it got really bad or noticeable even to me until I was about 19. So I'd say about the last 6 years is really when I would say I noticed it and would have said, "Oh yes, I'm struggling with anxiety right now."
Okay. Are you currently experiencing any chronic pain? You mentioned your lower part of your body, your calves. Is that chronic pain, or does it come and go?
I would say it's more like an injury than some long
Gotcha.
form chronic pain. I think I expect it to go away soon from
Okay.
physical therapy.
Very good. Do you drink alcohol more than once a week?
No.
Okay. How often do you engage in recreational drugs? Would you
I'd
say
say-
daily, weekly, monthly, infrequently, or never?
Infrequently.
Okay. Are you currently in a romantic relationship? I'd say yes, because
Yes.
you're a newlywed.
Yes, I am.
Congratulations again.
Thank you.
And how long have you been in this relationship?
I've been in this relationship for almost 2 years. Feels like way longer though, because I've known her for 7 years, 8 years.
That's awesome.
Mhm.
On a scale of 1 to 10, with 1 being poor, 10 being exceptional, how would you rate your relationship?
You're catching me at a good time for this one. I'd say like a 9.5. I don't know if any relationship could ever be perfect, so that's why I'm not saying 10. But for the most part, it's really wonderful.
All right.
She's my best friend and my biggest support, my biggest ally.
That's awesome. That is incredible.
Yeah, very thankful for her.
What significant life changes or stressful events have you experienced recently? I know you're a newlywed. You stated you're recently
Yeah.
married.
Yeah.
So
That's definitely a significant life
okay.
change. Yeah.
Okay.
I would say a positive one, but definitely, as far as a marriage, that's definitely a positive life change. But when you get close to somebody like that,
Mhm.
you feel more safe, or at least I feel more safe, and so
Mhm.
more stuff comes up, right, that maybe
Absolutely.
wasn't able to before
Absolutely.
from my past or from what I'm dealing with right now with my parents. So let's say getting married brought up stuff I was going through or dealing with that I wasn't fully aware
Absolutely. You feel like you're able to be more vulnerable.
of. Yes.
Okay. And that's a great thing to have
Mhm.
someone that supports you and that's committed to you and you being your best. So
Mhm.
that's awesome.
Yeah.
Have you ever had thoughts of suicide or past suicide attempts?
I'm not.
Okay. Have you ever had thoughts of homicide or past homicide attempts?
No.
Okay.
Not.
Alrighty. Do you currently have thoughts of suicide?
No.
No. How about homicide?
No.
No. Very good.
Mhm.
Glad to hear that.
Yes, me too.
The next
Glad
set
to
of
be able to say
questions. The next set of questions is more about your family mental health history.
Okay.
Once again, if there's anything you don't feel comfortable sharing, that's quite all right. Okay? And this set of questions, I'm going to go through just a list of things we have, and you can answer yes or no, and let me know what family member that's attributed to.
Sure.
Alcohol or substance abuse?
Yes, that would be my grandfather on my dad's side.
Okay.
I think that's it.
Okay. Alrighty. Anxiety?
I'm gonna say no, because I don't think it would be, I think everybody has some type of anxiety, but no anxiety disorders or somebody
Okay.
who's really, really going through it,
Sure.
I don't think.
Depression?
I think same thing, no.
Okay.
Yeah,
Domestic violence?
not that I know of. If I had to speculate, I think grandfather on dad's side, probably to some level.
But that's
not that
purely
Yeah,
speculation.
that's just a
Okay.
guess, so I can't say for sure.
Okay. Eating disorder?
No,
Okay. Obesity?
no,
Okay. Obsessive compulsive behavior?
yes.
Okay.
That would be my dad. Yeah,
Alright. Schizophrenia?
no,
Suicide attempts?
yes, that would also be my dad.
Alrighty. There's just a couple more questions. We're almost done, and I appreciate your patience.
Oh, of course.
And I appreciate you sharing this information.
Yeah, I'm happy to.
Are you currently employed?
Yes.
Okay.
Yeah, I'm a fitness coach.
All right, fantastic.
Yeah.
Which explains the 6 days a week
Yeah.
working out.
Yeah.
And you're employed full-time, part-time, or are you like contract, self-employed?
I'm part-time.
Okay.
I work for Orange Theory, so I'd say I work about 20 hours a week, somewhere around that.
Okay. Do you enjoy your work?
Depends on the day.
Mm.
I get more social anxiety than I used to, and
Okay.
I'm on a microphone in front of 20, 30 people who I
Gotcha.
don't know that well, so
So you would say that's a stressful part of what you do?
yeah.
Okay.
I would say it's 50-50.
Okay.
It depends on if there are people who I have good relationships with
Mhm,
in the
mhm.
class, then I feel way more comfortable, but if it's a bunch of people who I've never met or talked to before, then I have a tougher time for sure. I'm feeling stressed, I'm feeling tight.
Gotcha.
I think I would do much better in one-on-one personal training, but this is just a lot. It just works better with my schedule to do this, so I'm thankful for it, but
Okay.
when I don't have to do it anymore, I'll be glad.
Okay, okay. Do you consider yourself to be a spiritual or religious person?
Yes, so I'd say yes to both.
Okay. And if so, could you describe your faith or your belief?
Yeah, I was raised Christian, not really in any specific denomination, but both my parents are, and so I mean, I believed since I was little, but I wouldn't say I really started to figure out what exactly it was that I believed till I was in college and then kind of out of college and through therapy and just kind of my own exploration. I would say I'm still a Christian.
Okay.
I still go to church, but I've had definitely tougher time with people in the church than I used to. Just I see things a lot differently than I used
Yeah.
to, but I still believe in God and have more, I would say, religious flexibility than I used to, as far as like people who think they have all the answers and have it all figured out, when I think there is so much uncertainty and so much unknown, and to say
Absolutely.
that this is the way and this is it
Yeah,
feels a little just off to me. So
yeah,
I don't know. I'm a Christian who is figuring things out.
absolutely.
That's what I'd
And
say.
we all are.
Yeah.
You know, contrary to popular belief, no one has it all figured out.
Yeah.
So,
Yeah.
yeah, we're all works in progress.
Mm-hmm.
What do you consider to be some of your strengths?
That's a good question. I think I am. I think I'm a very consistent person with, I guess, just like loyalty,
Mm.
dependability, and I consider myself to be a very compassionate, empathetic person.
All great qualities.
Thank you.
And what do you consider to be some areas of growth that you like to work on?
I think my anxiety is the biggest one. It controls me a lot, and I have a love-hate relationship with it, because it's helped me in a lot of ways. Like, it helped and trapped me into a toxic relationship in college.
Mm.
Like, my body speaks to me a lot, and sometimes I wish it didn't so much.
Mhm.
But so I don't want to say I hate my anxiety, but I think I'm going to learn how to use it for good and not make it worse, because I think I can make it worse on myself by
Yeah.
putting so much pressure and saying, why are you feeling this, or
Mm.
or do better, or why are you still stuck on this, instead of just kind of feeling my feelings
Mhm.
and having the same type of flexibility and grace and understanding that I have for other people, which I feel like is a lot of people's problems. But I think I've gotten better at it over the years, but I want to keep getting better at it.
Absolutely, absolutely. What would you like to accomplish out of your time in therapy?
I think I'd love to learn some strategies for when I'm in those really anxious times, of how to kind of slow down and figure out what's going on, because sometimes it just feels like I don't know which end is up, and I think I just want to learn how to breathe better and be able to have better sight for what's going on inside. I think that's the
Yeah.
main thing.
And that's a great goal. to
Thank you.
have. And I'm going to try to help you to pinpoint some strategies, some things that you can do, some techniques that you can try that'll help you to understand that anxiety, what triggers that anxiety, and how to calm it or dissipate that anxiety
That
when
sounds
it's not
great.
serving you, when it's
Yeah.
not helping you.
Thank you.
I'd just like to take a few more of your minutes to ask you a couple questions. We're going to do what's called an anxiety assessment, just to kind of see where you are, to see where we can best be of help to you.
Sure.
Okay? And this won't take very long at all, but it's a list of questions, and there's 4 different categories. And specifically, it's over the past 2 weeks. How often have you been bothered by the following problems? So I'm
Okay.
going to ask you a list of questions, and your categories are going to be not at all, several days, more than half the days, nearly every day.
Okay.
And I can repeat that at any point.
I probably will need you to repeat
That's
stuff.
fine. That's
I'll
absolutely
tell you
fine.
if I forget.
So over the past 2 weeks, how often have you been feeling nervous, anxious, or on edge? Would you say not at all, several days, more than half the days, nearly every day?
I would say more than half the days.
Okay.
Yeah.
Over the past 2 weeks, not being able to stop or control worrying.
Several days, I would say.
Okay. Over the past 2 weeks, worrying too much about different things.
Several days.
Okay. Same question, different spin. Over the past 2 weeks, trouble relaxing. Not at all, several days, more than half the days, nearly every day.
Several days.
Okay. Being so restless that it's hard to sit still. Not at all, several days, more than half the days, nearly every day.
Several days.
Becoming easily annoyed or irritable.
I would say not at all.
Okay.
I get more irritated at myself than, or I guess that would still count. Maybe several days. We can scratch that out. Yeah, several days. Yeah.
Okay. Feeling afraid as if something awful is about to happen.
I'll say not at all.
Okay. Okay, well, thank you. I do have one other question. Last one. We did check some of the issues, the questions that I asked. How difficult have they made it for you to do your work, take care of things at home, or get along with other people? When you think about the specific questions that I asked, the feeling nervous, feeling anxious, not being able to stop or control worrying, worrying too much about different things, trouble relaxing, being so restless that it's hard to sit still, and being easily annoyed or irritable. How difficult? And on that scale, not difficult at all, somewhat difficult, very difficult, extremely difficult.
I would say somewhat difficult.
Okay.
Yeah, I think that covers it.
Well, what I'm going to do is I'm going to take all this information that I've gathered here today, and we're going to go over it, and I will have some feedback for you at our next session, which I'd like to schedule for next week, if that's okay with you.
Yeah, that would be great.
Okay. Well, thank you so much, Mr. Young. It's been a pleasure meeting you, and it's my goal and my intention to assist you with your anxiety. You have any questions or concerns?
No, I'm ready to get started, and I just appreciate you being easy to talk to. Thank you.
Well, you're welcome. Fantastic. I'll see you next week.
Sounds good.
All right.